helping keep modern Manx history alive.
So what was this big announcement today?
The department has published its strategy for the future of health services. It's an overarching strategic document which sets out the way in which we see health services for the Isle of Man developing over the next 10 years. It tries to balance a definitive document with some key targets and priority action areas, but also in a way that's flexible to reflect changing needs of society or changing medical interventions over that 10-year horizon.
Is this something that's done on a regular basis, or is this something that you've been working on specially?
It's something we've been working on for a little while, whereas the department had quite a considerable expertise in producing strategic direction for individual services, be it cancer services, renal services. There was a lack, I thought, of an overarching direction for health services as a composite entity. We needed to draw together a variety of strands to come up with a cogent document that gave a clear picture and a clear direction of travel for health services in the very broadest context.
Clearly you have one of the biggest budgets going, if not the biggest, and you're under pressure. That's also been made clear in the document that you've had to redefine where you're going since the VAT bombshell, for instance.
Well, the availability of government income and the availability of resources to invest in healthcare, of course, has to be something uppermost in our minds. It would be fairly fruitless to present a strategic document which had some kind of disassociation with economic reality. So we've strived to keep it real. But health budgets being under pressure and the expectation to deliver more and more is something that's entirely common and would be familiar to healthcare professionals everywhere. So managing budgets and delivering expensive services in circumstances of financial pressure, it's a fact of life for us.
I mean, what sort of state is the National Health Service here in the Isle of Man like now, and where will it be in 10 years' time?
Well, I guess you're asking somebody with a particular view. I would say that the NHS in the Isle of Man is in very good shape. It's delivered by professional, committed and expert people, but of course, like all public services, it's something which needs constant revision to bring about improvements wherever and whenever you can achieve them.
You had a review in 2006, and a lot of things were not implemented, I understand.
There was a review by the Healthcare Commission of Nobles Hospital in 2006. Many of the recommendations of that have been implemented.
It was a bit damning though, wasn't it, that the best practice hasn't really been put in place?
Well, in certain areas it suggested that improvements can be made. I think it would be a bit uncharitable to describe it as damning. But I think it's to the department's credit that it exposed itself to the scrutiny in the first place. We needed to know what the Healthcare Commission thought of Nobles Hospital services, and we've reacted to that. The health strategy document that we're talking about now makes it clear that that review is part and parcel of the rationale to take us to where we are today, and it's one strand of a whole range of work that continues to be done.
With an election coming up, will this interfere with this sort of work and what you've put forward for the next 10 years?
I would hope not. Our Minister has made it clear that this document is a clear direction of travel for the department, which he envisages being a blueprint for the future after the impending change of government in the Isle of Man following the September 2011 general election. I'm sure my clinical colleagues would agree with that. I think it's important that we have a long-term, clear strategic steer that's got longevity behind it to give ourselves a platform to develop healthcare in the longer term, and I think that it certainly will endure beyond governmental changes.
I'm just thinking that obviously there'll be musical chairs going on and you could end up in another department yourself, for instance.
It's possibly unlikely that I would be moved from the Department of Health. What is more likely is that we may have a new ministerial figure after the general election, and of course an early task for me and colleagues will be to set out to that person the purpose, the rationale, the background and the importance of this strategy.
Please subscribe to the Isle of Man TV archive channel. Thank you.